Good afternoon, everybody. I've got 3 topics to cover. I'll go one by one. First is the hand hygiene. With the COVID coming into play, that we all learned about hand hygiene. But here, what I'm going to show is why we do certain steps. And this is the post-op endophthalmitis. Definitely, we don't want to see like this. So, hand hygiene is very important. This is the culture from a relatively free hand, clean hand. It looks like this. So hand hygiene is very, very important, and a simple hand wash like this is not enough. So we need to follow all these steps described by the European norm 1500. These are the steps what we need to follow, and this is palm to palm on the dorsal surface, ventral surface, tip of the finger, knuckle, thumb, and the rest. Of course, the arm is also covered, but why we need to do these steps is being explained here using watercolor. See, when we rub using watercolor, this is not following the steps, what is described. If you look at carefully, the web space are not covered at all, which is very dangerous, where the prominent thumb is not covered, the entire web space is not covered. So if we follow all the steps described in European norm, see what's going to happen now. This is being demonstrated by Sukumaran sir. It took 2 days for him to wash it away after this. See, not a bit of a space is covered in this. I had been showing this video for past 10 years, and some people came with a query that this is using watercolor. What we are using povidone iodine, which is a liquid which will spread everywhere, it will clear. So I came up with a new idea. I put watercolor within the web space and did the usual hand wash. What we do, we followed all the steps, initially not covering the web space, and we washed just like what we do before we have our meals or anything, just like that. So look at that, the watercolor is still there. So if you follow the steps, all the steps what is described in European norm, you can see that at the end of it, the web space is clean. So it is important that you follow all the steps described in it. This is the proper way of doing it. I am not going to cover, you all know about it. I'll skip on to the next important thing. Once you do your hand wash, it has to be dried before you wear your glove or the apron, whatever it is. This is the wrong way of doing it. This is just drying the palm alone. So the proper way of doing it is using the 4-quadrant technique. I'll show you. This is the 4-quadrant technique. One quadrant is used for one hand. The second quadrant is used for the second hand. The third quadrant for one arm, and the fourth quadrant the other arm. This is the proper way of wiping. Then gloving. Once you have your gown, surgical gown on, there are different ways of wearing your glove. This is the standard way we follow. You touch the inner surface with the left hand, and without touching the outer surface of the glove, we wear while wearing the second glove, touch the outer side, and without touching the inner side. This is the standard way of wearing. and wash away any talc powder or whatever it is powder before you do your. But what is recommended now is the powder free gloves, which is the nitrile gloves, which is recommended for the ophthalmic practice. This is the way of using the nitrile glove. The same method we follow, and that's the way it is done. The other ways we do is the assisted way. The scrub nurse holds the glove for you and you introduce your hand into it, and without that. This is the yet another way of wearing the glove. This is very safe for the surgeon, and this is the best way of no touch technique. You cover your hand with the gown itself, and with the covered hand you hold the glove and wear it. This is the proper way of gloving. And once you're gloved, make sure that you don't make any mistake. Look at that. The drape is there and you're holding it underneath the table. It's very dangerous. And this, I'll just quickly go through this. We are using a lot of this disposable glove in our OPD. We just take like that, casually use it, thinking that it's going to protect us. It's neither going to protect you nor the patient by wearing a glove like this. So this is the way we normally do it. Now we are doing a procedure. Suppose there are some organism, maybe bacteria or virus, which is demonstrated here as green paint. See? And that what really happens is you're going to contaminate the glove. See, already that paint has come on the outer surface of the glove. So it's not going to protect you at all. So what you have to do is do hand hygiene, then take the glove and use it. Without a hand hygiene, this method, wearing a glove, is not going to protect you or the patient. Okay. So the best way is to follow you do a hand hygiene and then take the clean glove and do the procedure. Okay, thank you. That's hand hygiene.